So the ponytail facelift was developed by a doctor. His name is Dr. Chai-Chi Kao, and it's a procedure where you are doing a lot of endoscopic surgery. So with a lot of traditional open surgery, you have a lot of incisions. And with a ponytail facelift, you are making a smaller incision in your scalp and in your temple. And you're using an endoscope, which is a camera, and you're going underneath the skin to lift the tissue up and put it into a higher location. You know, when you look at someone's face and they're coming in, you have to decide, is it facial aging or do they want facial beautification? And now there's overlap in those two things, because people are getting older, do want to look prettier, and they want to look more beautiful. But a lot of patients who are having ponytail facelifts, they tend to be younger in their 30s or 40s, and they want to change the appearance of their face as far as the shape of the brow, the shape of the cheekbone, and put that up into a higher location. And so someone who's 30 or 40, it's not as much facial aging, it's more facial beautification. One of the complaints that people will have with facelifts in general is there's scars associated with it. And with a ponytail lift, there's a lot less scarring, particularly in front of the ear. And so you're doing the work mainly up in the hairline, and you're resuspending it with a lot of internal sutures to put the tissue up into a higher location. When I see patients who are interested in a ponytail lift, I try to really get at the root cause of what's bothering them. And is it more the laxity in their face and neck? Or is it the appearance of their brow and their midface? And so if patients have a lot of laxity of their brow and their midface, they'll be a better candidate for a ponytail type of lift where you're doing more endoscopic surgery. But as people get older and they have a lot more excess skin, then often I'll direct them more towards doing more of a traditional face and neck lift, often with tightening of the deeper structures with a deep plane facelift. So more patients are asking about this. I think anyone wants to look better, they want to look younger, and they don't want scars. And so it is something, but not everyone's a candidate for it. And it's a long procedure. And so these procedures take a lot longer than the traditional face and neck lift surgery. And often patients, when I talk to them about that, the procedure and the risks associated with that, they'll actually lean towards, say, doing more of a traditional face or neck lift. And so there isn't a right or a wrong answer. It's another tool in our toolbox, and it's another thing that we can offer patients.